Hi, my name is Alexandra Eppolito, and today I'm going to be talking about our seventh cranial nerve, which can also be known as our facial nerve. The facial nerve is actually the most complex of the cranial nerves. It is both a sensory and a motor nerve, which means that it has sensory and motor innervations. So the motor component actually originates in our pons, whereas the sensory component of the facial nerve originates in the nervus intermedius. So in regard to the motor function of the facial nerve, it can be divided into 5 lesser motor branches. So the zygomatic branch, it innervates the orbicularis oculi, which allows us to have functioning in our eye socket, which can allow us to blink, to squeeze our eyes closed very tight. The temporal branch innervates the frontalis orbicularis oculi and the corrugator supercilii, which allows us to have functioning and movement in our head and in our eyes. The buccal branch innervates the orbicularis oculi, the buccinator, and the zygomatic muscles, which allows us to have movement and functioning in our mouth and in our jaw. The marginal mandibular branch innervates the mentalis muscles, which allows us to have functioning in the lower portion of our jaw. And the cervical branch innervates the platysma. So these innervations all are occurring with muscles of both the head and the neck. So this allows us to be able to move and manipulate the muscles of facial expression, which allows us to express our emotions through the changing of our facial expressions. Then the stylohyoid muscle and the digastric muscle, particularly the posterior belly, it allows us to manipulate the hyoid bone, either through drawing it back, which allows us to elevate our tongue and then to swallow, or through elevating the hyoid bone, which allows us to make more complex jaw movements. And then finally, the stapedius muscle of the middle ear with the facial nerve allows us to be able to prepare our bodies and stabilize in response to a loud noise, whether in our external environment or internally within ourselves. So now for the sensory component of the facial nerve, we have sensory innervation, and the facial nerve innervates the anterior 2/3 portion of our tongue, which gives us a special ability to taste. And it also innervates a small area around the concha of the auricle, which is in our ear. So it's going to be up here. Now, besides also just being a motor and a sensory nerve, the facial nerve actually gives us certain parasympathetic functions, such as supplying the glands of the head and the neck. So submandibular and sublingual salivary glands, this is what allows us through the facial nerve to produce saliva. The nasal, palatine, and pharyngeal mucal glands, this allows us to coat our throat, nose, and mouth in mucus. So especially, when we're talking and so on and so forth, if we're swallowing. And then finally, the lacrimal glands are what allow us to produce tears. Okay, so today we'll be performing a cranial nerve assessment on my client, Erin. And we're going to specifically be assessing the function of her 7th cranial nerve, which can also be known as her facial nerve. So the facial nerve is both a sensory and motor nerve, which means that it has sensory and motor fibers. So the motor fibers of the facial nerve innervate in the head and neck area, which is what allows us to be able to change our facial expressions, elevate the tongue, and allows us to swallow. Whereas the sensory components of the facial nerve allow us to taste. So for the purposes of this assessment, first we're going to have our client look ahead straight and not make any sort of facial expressions. And we're going to note if there are any facial asymmetries, which, as you can see here, the client's face is perfectly symmetrical. And next we're going to move on and have the client perform a variety of different facial expressions. Can you please smile for me? Can you please make a frowning face? Can you please puff out your cheeks? And can you please close your eyes very tight? What this shows here is that the client is able to make and distinguish between different facial expressions voluntarily without any sort of issues. So prior to the assessment of my client, Erin, I did ask her an array of questions just to kind of get a sort of feeling of if she was having any difficulties. So I asked her if she felt like she was able to taste properly or if she was losing any sensation. She responded with no. She was able to accurately and efficiently, taste the different things that she would be eating or consuming throughout the day. I also asked her if she had any sort of lack of tear production, which she also reported no, as well as if she felt like her throat was very dry or that there was a lack of mucus. So as you can see, based on the cranial nerve assessment of cranial nerve 7 or the facial nerve, my client Erin was successfully able to switch and differentiate between a variety of different facial expressions and facial movements without any sort of inability to do so, which demonstrates proper functioning of the 7th cranial nerve or the facial nerve. So I think it's really important also to discuss why the 7th cranial nerve or the facial nerve is significant for us going into the field of speech-language pathology. So first and foremost, as SLPs, we're going to have the ability to work in such a range of settings and see such a different array of clients. So it's important to be able to realize if something is wrong or if something is not functioning to its highest potential, to be able to understand why this may be giving the clients that we see particular issues. So damage to the 7th cranial nerve or the facial nerve can result in paresis or paralysis, which depending upon exactly what caused said paresis or paralysis can have an effect on the site of the lesion as well as the different range of symptoms that can arise. The main etiologies following a facial nerve dysfunction are stroke, traumatic brain injury, or different forms of meningitis, and dysfunction of the facial nerve can result in a type of facial paralysis known as Bell's palsy, which results in an inability for the client to control the facial muscles on the affected side. So in terms of speech-language pathology, if we have a client and they're unable to move either a side of their face or a portion of their face, it's going to inhibit them to swallow properly and to even produce certain speech sounds. The facial nerve allows us to properly swallow and allows us to move the muscles in our face, which is a major element of how we produce different speech sounds.